We're going to get started here. Thank you all for taking time out of your busy weeks and days to be here for this training. It's really exciting. Zach, I'll read his bio, but he's our health education and campaign coordinator, and he's been leading our movement to educate health professionals about the health harms of gas stoves. And this is really part of our building electrification effort at PSR. So we're really happy to have you hear more about it. So I'm going to introduce Zach. He's an MPH, and as I said, he's our health educator and campaign coordinator for our environment and health program at our national office, which I'm also part of. And he has a background in climate and health education, social services for the LGBTQ youth, healthcare project management, and international emergency response. Zach received both his Bachelor of Science in Applied Psychology and his Master of Public Health from New York University, where he was able to work for UNICEF Communication for Development as a disease outbreak intern, just as the COVID-19 pandemic began to spread in the United States. Additionally, he had the incredible honor of being named the inaugural William N. Rahm Climate Change Fellow for the School of Global Public Health, focusing his studies around the climate crisis's impacts on human health. He helped to build the school's digital presence around climate change from the ground up and was asked to speak at the first International Summit of Climate Change and Public Health at the UAQ in Mexico. After graduating with his MPH in May 2021, Zach worked with both the Columbia Climate School and the Harvard Chan Center for Climate, Health, and the Global Environment as an instructor for each of their respective youth climate summits in the summer of 2021. Protecting the only home we will ever know in our lifetimes is his life's passion, and Zach is honored and excited to help PSR educate healthcare professionals about the human health effects of climate change. All right, so now that I've introduced Zach, you can take it away and ready to go. Thanks.
Thank you so much, Becca, for that wonderful introduction. And hello, everyone. My name is Zach Williams. Thank you so much for coming to this session today on gas stoves. I do apologize if you hear some background noise. I do live in New York City, and they are, of course, doing construction right outside my apartment. So I do apologize if you hear some grinding and some jackhammering. But I also want to make this much more conversational and discussion based. I don't just want to talk at you for 60 minutes. We're a small group here today as well, which perfectly facilitates some discussion. So I'll go ahead and get started with the content, and then occasionally I will stop sharing my screen. I invite you to turn your cameras on, and then we'll have a little bit of discussion for a couple minutes and then jump back to the content. Alrighty, so in that case, without further ado, let's jump right in. Today's session is called Cooking with Gas, Health Harms from Gas Stoves. Just a little bit of an outline of what today's presentation is going to look like. By the end of this, hopefully participants will be able to articulate how cooking with gas appliances produces dangerous indoor air pollution and explain the health effects of each pollutant. Next, recognize and prioritize vulnerable populations as well as understand why they are vulnerable. And next, address the health effects of gas stove pollution and explain to your friends, family, and anyone you come in contact with the steps you can take to reduce your risk of exposure. Before we get started, I would just like to ask you, if you could, to fill out this short pre-test. You can either scan the QR code or click the link that I just dropped in the chat. Shouldn't take more than two or so minutes. It's about 5 or 6 multiple choice questions. And then this will also coincide with a post test that we'll take at the end of the session so we can see learning achievement and get your feedback. So if you could take just 2 or so minutes to fill out that survey, I would be much appreciated. Thank you so much. And when you are done with the pretest, if you could just give a little, thumbs up reaction, just so I know that folks are done and when we could get going. All right, I'll wait for a couple more thumbs up and then we'll get going. Alrighty, so I've seen a couple more. It is not the end of the world if you haven't completed it yet. No worries at all. We'll get started first with some discussion actually for the group. So I have a question for everyone. What's the first thing that comes to your mind when you think of gas stoves? And here's where I'm going to stop sharing for a moment. And then I invite you to unmute yourselves, turn your camera on. What's the first thing you think of when you think of a gas stove?
I feel like I actually think of better control when you're cooking over
Sure.
heat,
Mhm.
but I know that's counterintuitive to this whole topic.
No, it's okay. The positive connotations are good too. We'll hear a lot of perspectives about gas stoves. Shannon, you turned your camera on.
Yeah, I was gonna say familiarity. I think I'm a lot more comfortable with gas stoves. I grew up with one and like have used them mostly. Yeah, and
Sure.
have also heard kind of similarly the control when cooking.
Right. Hope.
I kind of just think of the smell of the gas. It's just very familiar. I grew up, my childhood home had a gas stove, but now we've switched. So
There we go. Yeah, that constant, smell of methane. So yeah, anyone else, what's the first thing you think of a gas stove?
I think of just how ubiquitous they are. Like, I think most of the places I've lived in, they've had them. Like I don't see electric stoves nearly as frequently as gas stoves.
Right. And I think that also comes with, gas stoves are kind of like the prestige item. Like you walk into someone's home and you're like, oh, you have a gas stove. Like, you don't have that electric coil that gets screaming hot after 84 years. Yeah, any going once, going twice? Any other thoughts? Always had gas stoves, used electric stoves for the last year moving to the apartment. Great, thank you, Shreya. Any other comments, questions, concerns, thoughts about gas stoves before we jump right in? Alrighty, folks, I won't keep you waiting any longer. All right, so let me share my screen once again. Okie dokie. So the fact of the matter is, no matter how we feel about gas stoves, the fact remains that using a gas stove without ventilation produces dangerous indoor air pollution. This leads us to the first section of this training, which is going to be understanding the pollutants produced by gas stoves and the health effects they have on the human body. The primary pollutants produced by gas stoves include nitrogen dioxide, carbon monoxide, and particulate matter, which includes both PM 2.5 and PM 0.1. PM 0.1 is also known as ultrafine particulate matter, if you've ever heard that phrase as well. So what do these awful air pollutants do to the human body? Let's explore that for a little bit. First, let's go into nitrogen dioxide. NO2 is a harmful air pollutant that's produced by the combustion of fossil fuels, which includes the methane we burn in our gas stoves. NO2 contributes to the development of asthma, aggravated asthma, and increased susceptibility to respiratory infections, and it's also associated with negative general cognitive functioning. Next, carbon monoxide is another dangerous gas and perhaps more well known than nitrogen dioxide. Exposure to carbon monoxide can have neurological effects such as fatigue, impaired vision, dizziness, and all the way into falling into a coma. For cardiac patients, carbon monoxide could also cause chest pain. And at high enough levels or at long enough exposures, carbon monoxide can also lead to death. Lastly is particulate matter 2.5 and particulate matter 0.1. Just for context, PM 2.5 means any piece of matter that is smaller than 2.5 microns, and PM 0.1 is anything that's smaller than 0.1 microns, which is 100 nanometers. A lot of scientific terms here, but all that means is that PM 2.5, which is much smaller than the width of a human hair, settles on the walls of your lungs and causes irritation inside of your lungs. PM 0.1 is small enough to actually go through the lung tissue into the blood and cause cardiac and brain damage as well. So what does PM 2.5 and PM 0.1 do to the human body? They aggravate asthma, they decrease lung function and increase respiratory symptoms. They can also contribute to non-fatal heart attacks, irregular heartbeat, and premature death in people with heart or lung disease. Particulate matter has an asterisk next to it because the amount of particulate matter that is produced when using a gas stove is very contingent on what is actually being cooked, the type of food that's in the pot or the pan, particularly fats and oils like the olive oil, avocado oil, sesame oil that we use to fry things typically when we pan fry, produces a lot of particulate matter. So these are all the awful things that air pollutants do to the human body, but how much are we actually being exposed to? So let's explore that a little bit. Over here on the left, you can see the national standards and guidelines related to NO2 concentration. The United States does not have standards for indoor air pollution, so we use outdoor standards as a reference. As you can see, the US EPA national outdoor standard is 100 parts per billion, and the World Health Organization's is 106 parts per billion. For context, 1 part per billion is like dropping a single drop into an Olympic-sized swimming pool. So even though 100 may seem like a big number, 100 parts per billion is actually a pretty small amount of air pollution that the EPA says you shouldn't be around or breathing this for longer than an hour, you know? So data from the Lawrence Berkeley National Laboratory showed that in houses that were less than 1,500 square feet, indoor air levels of NO2 exceeded these standards more than 83% of the time when you cook with a gas stove without ventilation. And that goes up to 100% of the time when the homes are smaller than 1,000 square feet. So that's a lot of words and seems like it's important. So let's look at it graphically to really understand what that means. So here's a graph that I pulled from the Lawrence Berkeley National Laboratory study. And let's examine this real quick. So on the y-axis here, we have NO2 concentration on a logarithmic scale too. So this is not equal, equal little dashes. So we have 10 here, 100 here, 1,000 here. 100 parts per billion right here. This is what the EPA says. Please do not be around concentrations above this for longer than an hour. On the x-axis is time of day. And you could see these are each of the cooking functions that the researchers used to test and measure the level of NO2 inside the home. This particular house, they studied 8 houses. This particular house is less than 1,000 square feet, does not have proper ventilation, and has a gas stove. So kind of like the worst case scenario. And the red line is the measured NO2 concentration in the kitchen. And then the blue line is the measured NO2 concentration in a hallway or a bedroom farther away from the kitchen. And as you can see, each time that gas stove was on doing some kind of cooking function, whether it was the oven portion or it was the stovetop, every time that cooking function was happening, the levels of NO2 were well above what the EPA says, please do not be around this for longer than an hour. And again, this is a logarithmic scale. So this means that here is dramatically higher than what we would expect. So this shows graphically that yes, when you turn on and use that gas stove, there is a dangerous amount of nitrogen dioxide that is being produced in your kitchen and that you're breathing while you're cooking. So great. We're exposed to dangerous levels of air pollution, but what does that have to do with our health? So let's use a case study to explore this. And it's going to be focused on the most common respiratory effect of this, which is asthma, particularly childhood asthma. So here's another graph, and the study is entitled Association of Changes in Air Quality with Incident Asthma in Children, 1993 to 2014. Without going into every single part of the research methods and how wonderful this study is, all you need to know is that it is a multi-level longitudinal cohort study over more than 2 decades, which means that it is one of the best research methods to look at effects over time. And let's now explore this graph. So each of these different colored lines is a different neighborhood and a different community within the Southern California area, primarily around Los Angeles. Over here on the y-axis, we have the asthma incidence rate, which is the amount of childhood asthma that Southern California is seeing and reporting in their hospitals. And then on the x-axis, we have nitrogen dioxide, but pay attention, it's flipped. High concentration over here, low concentration over here. So as we can see, as Los Angeles got its act together over 20 years and really started to clean up the smog and the ozone and all of the air pollution that was sitting right over the city and the county, we can see that as NO2 concentration went down, so did the childhood asthma incidence rate. So what this is saying is that when you decrease NO2, you decrease the likelihood of a child getting asthma. So this is showing that, yes, so we've shown that these are the pollutants. These are how much we're exposed to, and the exposure levels are dangerous. And this is how those high exposure levels impact our health. The focus on children here is important because it leads us directly into our next learning objective, vulnerable populations, because children happen to be one of the most vulnerable populations to gas stove pollution for a myriad of reasons. First, children tend to have higher breathing rates, so they're breathing in more of the air pollution than an adult would. Next, children have higher lung surface to body weight ratios and smaller bodies. So an NO2 concentration that could be safe for an adult could actually be harmful for a child. And lastly, children's immature respiratory and immune systems are still undergoing development, and they don't necessarily have the ability to deal with stressors in the same way that an adult can. So children are more at risk for developing asthma and other respiratory symptoms from the pollutants produced by gas stoves. But I don't just want to focus on children here, because this is also an environmental justice issue and a health equity issue. So next, I want to look at some health disparities, still focusing on childhood asthma, but now looking at different kinds of components of society. So first, there's gonna be a lot of percentages on the screen. I'm not gonna say every single one, but just to know that the distribution of childhood asthma is skewed, and the data that I'm about to show come from the National Center of Environmental Health and a study from the German Journal of Urban Health. So first, let's look at housing type. 21.8% of children living in public housing have asthma, compared to just 7.38% of children living in private residences. Next, the prevalence of asthma in Puerto Rican children is almost twice that as white children, and the prevalence of asthma in Black children is more than twice that of white children. Next, let's look up income level and socioeconomic status. 11.8% of children living below the poverty level deal with asthma, compared to just 5.9% of children at 450% or higher of the federal poverty level. So all of this to say, living in a non-private dwelling, being Black, and living below the federal poverty level are all risk factors for childhood asthma, which is one of the most prominent health effects of gas stove use. And why is this? It's great that we have this data, but it's also important to understand context to get the full picture of what's going on. And to fully understand why being a person of color and of low socioeconomic status puts you at higher risk for respiratory illness in the United States, we have to look back at our history. So first and foremost, federal housing and transportation policies codified racism into the economic and geographic development of the United States in the mid-20th century. First, as an example, the Federal Housing Act of 1949 authorized the demolition of Black neighborhoods. And next, the Federal Aid Highway Act of 1956 authorized the demolition of urban neighborhoods that were labeled as urban slums and replaced them with the nascent interstate highway system. These urban slums were often poor neighborhoods or Black neighborhoods. This not only severed communities, which were most often communities of color, but also constructed long-term, permanent, polluting transportation infrastructure next to, near, and through communities of color. Secondly, although it's outlawed today as another example, many majority Black and brown neighborhoods are still reeling from the effect of redlining. Redlining is a homeowners loan corporation categorization strategy where some neighborhoods were labeled as high risk, whose residents should not be given access to mortgages. These neighborhoods were outlined in red on their maps, hence the term redlining. However, redlining now refers to lending discrimination that bases credit decisions on the location of a property to the exclusion of the characteristics of the borrower or the property. So it discriminates on who can get credit based on where the property is, what the property looks like, and who is the borrower. Redlining prevented investments in infrastructure, in green space, public transportation, business development, and all other aspects of city planning that make for a successful and prosperous neighborhood. Because banks refused to give loans to Black Americans decades ago, their descendants now deal with increased levels of air pollution and a lack of political will to competently and systemically address these issues. And when I say lack of political will, that is certainly not on the part of the citizens and citizenry that exist in these neighborhoods. Mainly it exists with the city councils and the legislators that have the power to turn the levers to make things better and simply don't. Next, I don't just want to focus on race when we're talking about environmental justice, because this is also a class issue. So let's take a look at the data to see why lower income households are also at higher risk of being exposed to high levels of gas stove pollution. First and foremost, it's important they tend to live in smaller unit sizes. It's important to remember that homes that are less than 1,000 square feet exceed the outdoor standard for NO2 100% of the time when you are using a gas stove and you do not have ventilation. Along with smaller unit sizes, low-income folks also tend to have more people per household than higher income households. So not only are more people using the kitchen, but more people are also being exposed to the gas stove pollutants. Next, low-income families are also more likely to live in older homes and have less control over the maintenance of their appliances. Older homes may have gas stoves that haven't been properly adjusted or may still even have a pilot light, and are more likely to have inadequate ventilation over the stove. Having a cooking appliance with a pilot light is an important characteristic to remember here, because that means there is just methane burning constantly in your home if your gas stove has a pilot light. It's great for convenience when you want ramen at 2 a.m., but it also means that there is fossil fuel constantly burning inside your kitchen. Next, low-income homes are more likely to use stoves and ovens for heat. Homes with inadequate ventilation, poor landlord management, and poor insulation make families in these situations turn to the most readily available source for heat, which is typically their kitchen oven, which does provide relief and it does heat the home. However, it also pumps the home full of air pollution. Next, low-income homes are also more likely to have higher exposure to outdoor pollution for all the reasons that I just talked about on the last slide. Think about, when these urban slum neighborhoods were demolished and replaced with interstate highways. I'm thinking of, as a New Yorker, the South Bronx. The South Bronx is a convergence of the Major Deacon, the Bruckner, and the Cross Bronx Expressway. And particularly Hunts Point is a neighborhood that lives at the epicenter of those three and has the highest air pollution rates in the city and the highest hospitalizations for childhood asthma in the city. So low-income homes are also more likely to be next to or near outdoor pollution. Next, and finally, low-income homes are also more likely to already have a greater asthma burden, which makes them more sensitive to lower levels of nitrogen dioxide and other gas stove pollutants. And with that being said, I know I just threw a ton of depressing information at you, but I do want to have a little bit of discussion. I know this slide says patients, and I know we might not be health professionals that see patients in this room, but I'm going to stop sharing my screen. And I again invite you to unmute yourself, turn your screen on, and we'll have a little bit of a discussion in your personal life, with your families, with your loved ones. Have you ever seen any of these issues come up around gas appliance use? And it doesn't necessarily have to be a gas stove. It could be a gas furnace, a gas water heater, any kind of burning of fossil fuels for energy inside the home. Has anyone ever seen any kind of health effect like this?
Hello.
Hello.
Thank you for sharing. But for me, I'm in Nigeria, and coming from Nigeria, so many families still use gas stoves. Actually, more than 70% of families in Nigeria still use gas stoves, and I've seen situations whereby families were wiped out. Why? Because they live in a very small room. They use gas stoves to cook, and there's not enough ventilation. And they forgot that probably they had something cooking, and before the next morning, an entire family was just died from carbon monoxide suffocation. So it's something that's terrible. It's something I've witnessed. It's something that is real. It's something that happens over there. So, but I didn't know that people still use gas stoves over here in the United States. But it's good to learn every day.
Absolutely. And thank you so much for sharing. Of course, it's absolutely an issue. No matter where we are in the world, I know that, there's been this big push by global health professionals to try and get folks to stop using like wood burning stoves or wood burning cooking inside the home because there isn't a lot of ventilation. It also is a gender issue because most often it is women who are cooking and then also who are caring for the children. So women are much more likely to be exposed to these pollutants as well. So yes, it's an issue. It's definitely an intersectional issue. And as a professor in grad school, I like to say, everything impacts everything. So it's a race issue, it's a class issue, it's a gender issue. The use of fossil fuels is just, wow, categorically not good. Anyone else have any anecdotes, thoughts, something that you may have seen in your life with fossil fuel use and health effects?
This is not as much to do with gas stoves, but like carbon monoxide. I just moved to a new apartment. I guess the old tenants took out the smoke detectors and carbon monoxide detectors, and I was really freaked out because I know I've heard a lot of different stories about just carbon monoxide, and it's colorless, so you can't see it. So the first thing I did, I just bought my own smoke detector and carbon monoxide detector because we also have a gas stove here, and the landlord, of course, is kind of negligent and we don't have like really good ventilation. So I was like, let's get on that right now. So Yeah.
There we go. And good that you went and did that, because of course it's good to have a carbon monoxide detector. We'll talk about the carbon monoxide detectors in a little bit, because the next session is actually going to talk about solutions. And just to wrap up our discussion here before I get to solutions, I did not personally experience this, but a colleague of mine at our San Francisco Bay chapter told us an anecdote. Again, it's anecdotal evidence, so it may not be peer reviewed and scientifically published, but all of her life, she had a gas furnace that was heating her home. And she would notice that in the winter, when of course the furnace turns on to heat the home, her wheezing and her asthma symptoms got incredibly bad, much worse than they were in the summer. She just attributed it to, being in the home all day. It's winter, you're not going outside, not a lot of airflow, she just can, associated it with that. Recently, I think she said about 3 to 4 years ago, they replaced their gas furnace with an electric furnace. And she said that the past couple winters have been fine for her asthma symptoms. It is dramatically better than it was when the gas furnace was going. And she no longer, has these bouts of respiratory issues during the winter when the furnace is on, because the pollutants aren't being, pushed to the vents to heat the home along with the heat. So again, anecdotal evidence, but, just another example of, this is something that happens to us, but it never occurs to us that it's, fossil fuels in the home. Who thinks of that? It's allergies, it's a headache, it's, whatever I need to do. So just keep in mind that anytime you see some of these vague symptoms come up, just take stock of how much gas you're using in your home, Alrighty, so let's get to the last section of this session. So let's talk about solutions now. And before I get into the nitty-gritty of the actual solutions you can do, I do want to talk about solutions in general for a moment. To properly address this complex health issue, the solution should be multifaceted and systemic. First and foremost, the solution should address the target health effects that you're experiencing and should be within feasible and correct medical practice. Ideally, the solution should also incorporate and acknowledge the living environment and should aim to improve the quality of that environment. The intersection of these three core aspects is the ideal, perfect situation. However, we all live in reality where nothing is ever perfect. So let's actually dive into some solutions that you can take to reduce your risk of gas stove pollution. First and foremost, I do just want to continue on some risk assessment. We did speak already about vulnerable populations, but I just want to list some more and some also behavioral risks so that you can take stock and do some risk assessment for yourself and see, if you are in an at-risk group. So here are some expanded at-risk populations for gas stove pollution: children, the elderly, people living with diabetes, people of low socioeconomic status, people living with obesity, and those with pre-existing heart and lung conditions as well. Next, just some lifestyle and behaviors that could put you at higher risk. What are your hobbies? And by hobbies, I mean, do you go running in a neighborhood with high levels of air pollution? Do you have access to ventilation, and do you use ventilation? Do you use an exhaust hood when you cook? Do you smoke? Obviously, a smoker is going to have higher susceptibility to respiratory issues than a non-smoker. Do you even use fossil fuels inside your home? Do you have a gas connection? Do you have gas appliances? Because that's really the thing we're talking about here. What's your time spent in heavy traffic, and what are your in-car behaviors? Because again, as we talked about that transportation infrastructure, those highways, those busy roads tend to be parking lots, just pumping out car exhaust all day. And that does get into your lungs as well. And then of course, living near an industrial or a fracking site is of course going to increase the amount of outdoor air pollution that you are exposed to as well. So here's some risk assessment to take stock and say, okay, where's my risk level right now of being exposed to these air pollutants? Next, let's talk about some actual steps you can take in the kitchen to reduce your risk of exposure to air pollution. So I'm going to go through each of these little bubbles real quick. So first and foremost is install and maintain a carbon monoxide detector, just like Becca said before during our discussion. Now, I learned recently from a PSR member that not all carbon monoxide detectors are made the same. Most carbon monoxide detectors that we have in our homes only go off when levels are at fatal levels, when if you stay any longer, you're probably going to pass away. However, the levels that are produced by a gas stove aren't high enough for a carbon monoxide detector to go off. So there are lower level carbon monoxide detectors that will go off when there is heightened levels of carbon monoxide, but not high enough where all of a sudden there is a terrible risk of fatality. So if you would like to install and maintain a carbon monoxide detector, I would just say to look for one of those low level ones so that it catches the pollutants that are coming out of the gas stove. Next, if it's available, if you have one, please run your exhaust hood over your gas stove. Now, the exhaust hoods are a tricky issue because of all of the appliances in our home, our dishwashers, our washer dryers, our, all of that, most require an outdoor exhaust connection. Gas stoves do not. So, for example, I have a gas stove here in my apartment. And my exhaust fan is simply built into the microwave above it, where it just blows the air above my head and then mixes it in with the rest of the kitchen. It does not go outside. However, even just some airflow from turning that fan on is more likely to get the air pollutants mixed up and hopefully out a window instead of it just sitting concentrated right near the stove while you're cooking. Next, I'm going to skip over this real quick. In relation to the exhaust hoods, I also suggest cooking on the back burners because the pollutants that come from the back burners are much more likely to hit the exhaust hood than if you cook on the front burners, which are much more likely simply to just spill out into your kitchen. Next, this is my favorite because it's free 99. You can open a window. It's the simplest solution to reducing your risk of gas stove pollution. It's what I do when I cook because I really don't have a good ventilation system here. So I just make sure I open my kitchen window anytime I'm using my stove or my oven. Again, as a lifelong New Yorker, I realize that I'm a little biased here because I understand that opening a window during wildfire season in the West probably isn't great. When it's a blizzard in Minnesota, it probably isn't great. If you live on the first floor of an apartment building in a neighborhood where you don't feel safe opening your window, probably not great. But if you have the ability to and you feel safe to, always, always, always open a window when you are cooking with a gas stove. If you can't do any of those solutions, but you still have that gas stove in your kitchen, I would say try different appliances. Any kind of plug-in, plug-out countertop appliance, a toaster oven, an air fryer, a kettle to boil water, anything to just reduce the amount that you are using that gas stove is going to help. Now, if you're really looking for that pan-fried burner function, you could also try a plug-in induction stovetop. Again, I'm not trying to sell y'all anything. I promise I'm not working for Mr. Bezos, but I have done some search on some online retailers. Some single burner induction stovetops are around $60. The double burners are around 110, 120. It's a pretty penny. But it certainly is cheaper than trying to go through the hassle of replacing the gas stove entirely. And they work pretty well, and it works through induction, electricity, no fossil fuel pollution. However, if you want to get at that root cause of what is causing the gas stove pollution, it's the gas stove. So if you have the ability to rip your gas stove out of the wall and replace it with something else, I highly, highly suggest replacing it with an electric induction stove. And I'm going to give them a little bit of a spotlight right now too, because I know we just talked about in the beginning, gas stoves are better, more control, electric stoves take 84 years to boil water, all of that. We may have some horror stories in our mind of those horrible electric resistance coils that smelled bad and, you know, didn't really get hot really quick. But luckily we're in the 21st century and there have been some wonderful improvements to electric cooking, particularly with induction cooking. So why I highlight these, I'll give a couple reasons. First, it's electric. There is no fossil fuel pollution inside your home. Now, a caveat to this, I say inside the home, particularly because the majority of electricity in the United States is generated by the combustion of fossil fuels. I acknowledge that switching to electric may reduce your fossil fuel use inside your home, but it certainly does not prevent fossil fuel pollution next to the power plant. However, you are not, and your family is not, inhaling fossil fuel pollution when you use an induction stove. Next, it lowers household accident risk because of the way induction stoves work. So as opposed to a gas stove where you turn it on and it's quite literally an open flame in your kitchen that is making not only the pan, but the entire range and the entire appliance screaming hot. Induction stoves work through sending an electric current through a coil beneath this glass, and that electric current generates a magnetic field. When you put a magnetic, any kind of material that will interact with a magnet, stainless steel, pretty much anything you can get at Target, when you put a pot or a pan on that burner that's on with the magnetic field going, the charged particles in the pot or the pan resist that magnetic field, and that resistance is what makes the pot or the pan get hot. What's fun about this is that because it's magnetism, only the pot or the pan is getting hot. The entire, you can put your hand next to that glass, next to that burner on the glass stovetop, and it will not burn. So if you have a little one that's touching and grabbing and they, you know, grab up on the burner, they're not going to burn their hand. Don't let them touch the pot's going to be hot. But again, it lowers household accident risk as well. And next, it's an investment in your family's health. I know, especially now, not everyone is made of money. It's a terrible time right now, especially after COVID. But if you have the ability to, it is a great investment in your family's health to stop using fossil fuels inside your home and replace it with an electric option. And again, if it's not possible, if you rent like I do and you can't, you know, rip the appliance out of the wall, or if it's just not feasible to replace a kitchen appliance right now in your budget, trying one of those plug-in, plug-out electric induction burners is a great mitigation strategy that's cheaper. And, you know, put a big cutting board over the gas range and just don't use it, and use those plug-in, plug-out appliances as well. Next, instead of just talking about what you can do individually, I do want to talk about some policy things real quick before we get to the discussion part of this, because it's all well and good to do individual actions, and that's what we need to do to reduce our risk. But if we want huge systemic change, it needs to come from policy. So raising your voice and joining the movement is one of the most incredible things you can do to reduce our fossil fuel use inside and outside the home. First, your local county and state legislators. Although we need it, the change is not going to come from the federal government. It is a behemoth and it is like bashing your head against the brick wall. What is most likely going to happen is that change is going to come from local and state governments taking up these issues and spreading them across the country in a grassroots fashion. So join a town hall or a city council meeting, provide comments to state legislative proposals, and raise your voice, voice your concerns about using fossil fuels in our homes and businesses. And remember, it's not just the environment that's being harmed, it's also our health. Next, incredibly important, are public utility commissions, otherwise known as PUCs. They have an incredible amount of power in determining what fuel sources a state buys for energy. There's approximately 3 to 5 public utility commissioners per state, and it's a hell of a lot easier to try and convince 200 people to make the green transition than to convince 330 million people to, like, I don't know, stop eating meat or something, you know? A real life example of a success story of the citizenry urging their PUC to do something green is in Nevada. It's one of the hottest and sunniest states. And in 2015, the PUC essentially outlawed the use of solar energy, which is baffling and unintuitive. And the citizenry and the concerned citizens took that up, they protested and they raised their voices and they forced the PUC to reverse the decision. And now Nevada is one of the biggest solar states in the nation. So this is an incredibly good leverage point if you're looking for something to get politically active, but you can't write another email to your senator, you know? So lastly, if you want more boots on the ground activism and actions to take, joining your local environmental justice or housing justice group can really add some more weight to these movements of the voices that are most often left behind. Like we said before, this is an environmental justice issue, and this is absolutely a housing issue because the housing stock, particularly of low income people, just doesn't make sense to make the green transition without some help from policy. So these are some actions and some groups that you can go towards if you're looking for some policy action. And right before we get to the discussion, I want to say something that is being touted as a solution, but is not, and is a perfect opportunity to raise your voice and join a movement. And that is hydrogen blending. I'm not going to spend a lot of time on this because I want to get to the Q&A, but essentially what's happening is the oil and gas industry sees the writing on the wall. They know they have to greenify their industry somehow. And so they are proposing hydrogen blending to do that. The proposal is to take hydrogen and blend it into our methane gas, natural gas system to reduce the amount of methane that's needed for energy. Oh, look, great, you're reducing methane. The gas industry is doing something good. Unfortunately, it's not good for two reasons. One, for the climate. The process of acquiring hydrogen is an incredibly energy intensive process. There is something called green hydrogen, which is produced through a process called electrolysis. And the energy for that electrolysis comes from solar and wind and other renewable energy sources. So it's hydrogen that is being produced with no fossil fuel input. Green hydrogen makes up 0.1% of our hydrogen stock. It is not at scale and it is not ready to say what the gas industry says it's going to do. Most often, hydrogen is produced by using an incredible amount of fossil fuels to get the energy needed to produce hydrogen gas. So it is a solution that says, oh, we're using less methane, but you need to use more methane to produce the solution. Doesn't make sense. It's not going to work. Next, for our health, it's not good. When you combine hydrogen and methane and combust it, like we do in our gas stoves, that combination of hydrogen and methane produces more NO2 than if you just combusted methane alone. So again, their touted solution is worse for the climate and actually worse for our health. So if you hear your local jurisdiction, if you hear your city saying, hey, we may start looking into hydrogen blending as a green transition proposal, it's a wonderful time to raise your hand, stand up in the town meeting and said, absolutely not, and here's why. So with that, that is the end of this presentation. Thank y'all so much for joining and listening to me talk at you for these past couple minutes. If you would be so kind as to complete this short post test, you can either scan the QR code on the screen, or I have just dropped the link in the chat as well. And totally okay. I'm not gonna like make us spend 2 to 3 minutes on us filling that out. If you could just open it, keep it open on a tab, and then fill it out when this session ends, I would be unendingly grateful. It is the same 6 questions as the pretest, and then also just some feedback data. How do we do? What'd you like? What could we improve on? All of that kind of stuff. So with that, I'm going to stop sharing my screen so I can look at all your beautiful faces. And I'll open it up for any questions, discussion, comments, questions, concerns that y'all have. Anything come up during that presentation that you're unclear on? Any questions you have? By all means.
A question I had is, so like when we're talking with patients or like we're in a primary care office, would you recommend kind of doing a screening question? What kind of stove do you have? And then asking a little bit about like how it's used. Is the vent on? Like what are plans might that have to get replaced?
Right.
How would you strategize kind of bringing that into primary care?
Sure. And I also completely understand that you typically have like 10 to 15 minutes, maybe probably less with a patient. So I will not ask you to give the whole spiel about how bad gas stoves are in that 10 to 15 minutes, because there are probably other things that you need to do and worry about. But what I would say is if you notice vague symptomology, coughing, trouble breathing, headaches, fatigue, that may be a sign of chronic fossil fuel pollution. So if patients are coming in with kind of this vague symptomology, it may be good to just be like, hey, do you have a gas stove? Or like, hey, do you have a gas appliance? Do you use gas in the home? Because that may open up a discussion and a conversation of like, well, yes, we do. Oh, we just got a gas stove installed and wasn't noticing this before. But now that you say that, oh my God, I cook a lot. And so just that simple, like, do you use gas in the home? That would be a great screening question to then open up the conversation. But I'm not going to tell you to waste 5 minutes of your 10 minutes on speaking about fossil fuels in the home. But just the simple question of, do you use gas in the home? That'd be good. Any other comments, questions, concerns? Also, feel free to drop them in the chat. You know, if you don't want to unmute or turn your camera on, no worries. Yes, Becca.
I just want to say, because I know some people might have to head off soon. Well, first of all, thank you so much. I learned so much every single time because you do it a little differently. But I did want to say, if any of you like want to get a little bit more involved in this, like as a project, or just take a little bit more action, like kind of some of the policy suggestions that Zach suggested are open to you. But also we do have more resources that we will be handing out to with different fact sheets. And they're also like, it's part of the building electrification effort, as I said. So if you are interested and this just piqued your interest as something that you want to really like advocate for, maybe in your medical school or whatever school you're at, it's a really great thing to get involved with, especially because there's a huge momentum around it right now. So just email me. I don't know, Zach too. I'll CC him in, and we can give you plenty of resources and connections for that. Just want to say that.
And I did just drop my email in the chat. Always welcome to talk about gas stoves and building electrification. This is, I'll be sending a follow-up email with Becca. There's a couple fact sheets that we have and some resources on our website that are good. And also, if you're looking for additional resources and work around this, there are some groups that aren't necessarily health focused. We're the health focused ones, but folks that are also working towards building decarbonization and building electrification are, I can write them in the chat actually, are RMI, previously known as the Rocky Mountain Institute, and the Building Decarbonization, I can spell that correctly, Building Decarbonization Coalition. Those are two wonderful groups that do a lot, not just on the health side, but on like the manufacturing side and the policy side. There's a big effort right now to try and put warning labels on gas stoves. I'll also put this in the follow-up email. There is an effort going on right now from USPIRG, which is going through the consumer safety, there's another word in that acronym, the Consumer Safety Board through Congress. They're trying really hard to get them to acknowledge the dangers of gas stoves and to put a warning label on, have manufacturers put warning labels on all of these gas stoves. So there's a letter, an open letter that they're inviting everyone to sign. We'll put that in the follow-up email as well. And any other comments, questions, concerns, hopes and dreams?
I did know a few of you guys signed it. Oh, sorry, at least. So, but I'll send it around again, the PRG letter.
Great.
No, I didn't have a question. I was just going to say thank you so much for this talk. It was very informative. I've heard a lot about generally this issue, but I haven't had the time to explore it. So this was a really great educational experience for me. Thank you.
Great, you're so welcome. And if you want to get a little bit more into the weeds of like the data and the science of it, there is a recent study published by Stanford in January that was a huge like bombshell thing. A bunch of people reported on it, and New York Times, WAPO. Essentially, they discovered that gas stoves leak much more methane when they're not being used than we previously thought. So there is a ton of methane leaks in your kitchen as well. So you can go and read that. I'll put that in the follow-up email too, that Stanford study. And don't tell anybody, it's insider secrets, but there is the study that's about to be published in a couple weeks, I do believe. That is essentially the follow-up to that by another group that says, oh, look, there's methane leaks. Look at all of the awful health effects that come from methane leaks in your kitchen. So again, just like Becca said, it's really, there's a movement building in this. I recently just saw a viral tweet on my timeline that simply just said, I've been black-pilled about gas stoves. So folks are, really trying to talk about it and are realizing that maybe cooking with an open flame in our kitchen isn't so good, So, all right, with that, it's about 2:57. If no one has any other comments, questions, concerns, thank you all so much. What a wonderful time.
Very quick, sorry, real quick, just for ambassadors, we do have our meetings next week. It should be a good time. I'll be sharing like some projects that have been more fleshed out, and we'll be doing some more networking and some other resource sharing. So if you can make it, great. You can choose Monday at 2 p.m. or Wednesday at 7 p.m., whatever works for you. And if you can't make it, just let me know. I'll be in contact with all of you, and hope you have a wonderful rest of your day.
Thanks, y'all. And open your window when you cook.